हेलो फ्रेंड्स, टुडे वी लर्न रिगार्डिंग दी एनेस्थीसिया। वीडियो स्टार्ट करने से पहले मैं कहना चाहूँगी, अगर आपको मेरा ये वीडियो पसंद आए तो प्लीज़ इसे लाइक शेयर एंड सब्सक्राइब करना ना भूलें। नाउ एनेस्थीसिया इंट्रोडक्शन। Anesthesiology is the branch of medicine that is concerned with the administration of medication or anesthetic agent to relieve pain and support physiologic function during a surgical procedure. Now, criteria for choosing anesthesia includes the type, duration and extent of surgery, patient's hemodynamic stability, then presence and severity of coexisting disease, patient mental and emotional status, options for management of post-operative pain, then surgeon preference and any particular requirements of the surgeon. Now, types of anesthesia includes local anesthesia, regional anesthesia and general anesthesia. Now, first one is the local anesthesia. It is a technique to induce the absence of sensation in a specific part of the body. In that first one is the local infiltration. The agent is injected intradermally and subcutaneously into tissues and around the incisional site to block peripheral sensory nerve stimuli at their origin. The surgery should not be extensive to suture superficial lacerations or excision of minor lesions. The patient receiving adrenaline should be well oxygenated होना चाहिए. You can see in a figure, subcutaneously and intradermally local infiltration is given to the patient. Then like a minor surgery, dental surgery, then for the dressings, okay, then for the minor lesions we can give a local infiltration, that is the local anesthesia to a patient. Now nerve block, it affect on large single nerve or nerves commonly used in a surgery of fingers and toes. The supplying nerve of particular area is anesthetized. Now topical agent for the local anesthesia, in that used for superficial nerve endings, particularly those of the mucous membranes. The agent may be swelled, sprayed or applied in a drops as for eye surgery. You can see in a figure topical anesthetic agents used in a eye surgery. Now second one is the regional anesthesia. In that first one is epidural. It introduced into the epidural space of the spine. It affect on nerve roots of the spinal cord and the area supplied by these nerves are anesthetized. The anesthetic is injected outside the spinal canal, in that no direct contact between the spinal fluid and anesthetic. इस फिगर में आप लोग देख सकते हैं कि एपिड्यूरल एनेस्थीसिया में स्पाइनल कॉर्ड, फ्लूइड और एनेस्थेटिक एजेंट के बिटवीन में कोई कांटेक्ट नहीं है, डायरेक्टली ये एपिड्यूरल स्पेस में दिया जाता है. Now caudal, it directed into the caudal canal at the sacrum and ideal for obstetrics and procedure on the perineum. You can see in a figure caudal epidural steroid injection is given in a caudal canal. Now spinal anesthesia, injected into the subarachnoid space at the 4th or 5th lumbar interspaced. Agent come in contact with the spinal fluid, ideal for surgery of the lower pelvis, as you can see in a figure. As you can see in a figure, difference between the epidural and spinal anesthesia. In a epidural anesthesia, no contact with the spinal fluid is there. In a spinal anesthesia, contact with the spinal fluid is there. And for giving a spinal anesthesia, we have to give a C-shape position to the patient. Now local and regional anesthetic agents includes the aminoamides. For that, bupivacaine hydrochloride, lidocaine hydrochloride, myovacaine hydrochloride. Then amino ester includes the chloroprocaine hydrochloride, procaine hydrochloride and tetracaine hypochlorite. Now third one is the general anesthesia. It causes the unconsciousness, provides analgesia and muscle relaxation. Depending upon the type and amount of agent used, the patient may be slightly or not at all responsive to stimuli. A combination of agents is frequently used to achieve the desired level of muscle relaxation and analgesia. Now 4 stages of general anesthesia includes the first one is the induction. It is the beginning of administration, last until the patient is unconscious. The patient remains an exaggerated sense of hearing until the last moment All personnel in the room remain as quiet as possible during induction. Now, excitement stage. During this phase, the patient is delirious and sensitive to external stimuli. Involuntary muscle activity and struggle may be seen. Patient is physiologically unstable in this stage. Now, relaxation stage. Surgery may be performed safely. The patient is relaxed, unconscious of pain, and is physiologically stable. Breathing is steady and automatic. This phase ends at its deepest level with respiratory paralysis. Now, fourth stage, danger. This stage begins when the amount of agent causes such severe depression of the central nervous system that the patient is in immediate danger of a cardiopulmonary arrest. Now, common side effects of general anesthesia includes the confusion and cognitive decline, sore throat, chills and shivering, headache, nausea and vomiting, and muscle pain. Now, most commonly used general anesthetic agents for a general anesthesia includes the inhalation agent, that is nitrous oxide, halothane. Then injectable agent includes the thiopental sodium, propofol, then ketamine, hydrochloride, fentanyl, diazepam and midazolam. थैंक यू फ्रेंड्स। अगर आपको मेरा ये वीडियो पसंद आए तो प्लीज़ इसे लाइक शेयर एंड सब्सक्राइब करना ना भूलें।